Hi, I'm Dr. Madhu Agarwal, and I welcome you to my office today. I always try to think of my patients as what I would do if they were my mom or my sister or my kid. So hopefully everyone on my team feels that way too, and we try to make people recognize that we really do try to treat them like what we would do from a medical perspective if it were our family, and I really try to treat patients just like that. I really enjoy being there for people when they need it, and basically being able to either do something medically or surgically that allows them to live a better life, or just being there when they're at sometimes their toughest point in life, and sometimes a healthcare problem can be just that. You know, I meet people on a daily basis that are in a very tough situation, and it's so awesome every single day to be here for when they really need you. I manage optic nerve disease, which is very unique. I manage eyelid issues, and I manage eye muscle issues. So I always joke that a lot of ophthalmologists do the house and I do the yard. I think a lot of what patients are worried about is the unknown. Like, if you don't know when the other shoe's gonna drop, the other exacerbation of their disease is going to occur, it's really nice to be able to maybe tone down their anxiety a little bit. I got really into reconstruction and rebuilding eye sockets and eyelids, and so I always had a plastics interest, and the optic nerve part, I was just trained by phenomenal people in that specialty. I always try to do a lot of my surgery here in the office. It makes people really more comfortable. If it's a bigger procedure, I usually have them do Valium or even droopy eyelids. Sometimes it's nice to just take a Valium before they come in, or something really easy like that. And then we do local lidocaine, which just is what you would do when you go to the dentist. And so it's very straightforward, very easy for patients to manage. And sometimes going to the hospital, we'll do for eye muscle surgery and for big eye socket cases, which I do regularly as well, because those need someone to be completely asleep. But for all my eyelid surgeries, whether it's a biopsy or a lump or a bump or rebuilding someone's eyelid after skin cancer, so we're really excited to be able to treat patients and come up with a way that a lot of our patients actually come to see me with, hey, you might have this horrible disease, go see Dr. Agarwal, which is really scary and really frightening. And it's wonderful to be able to tell patients that, you know what, I actually don't think this is that big of a deal. It's not that bad. We looked at your MRI. It actually looks pretty good. Or maybe it wasn't what we thought it was originally, so we can tell them that it's something a little different, and that's not their diagnosis after all. I see a lot of patients that are told, gosh, you might have a brain tumor, go see Dr. Agarwal. You can imagine how incredibly scary it is to hear those words. So it's really nice for, often I'm telling patients that it's actually not that at all, and you're going to be just fine, and they love that. When I'm not at work, I am hanging out with my 2 high schoolers, or hanging out with my physician husband, or I danced for a musical for Chalk Follies this year and last year as well. I helped raise $2 million for Chalk Children's Hospital, and otherwise I'm very active. I'm running or walking or dancing or doing something all the time. I can't sit down. I really understand that you have a lot of options in where you go for your health care, and whether you see me or not, I am really excited for you to have the very best outcome possible, and I wish you the very best from my heart to yours. Thank you.